The time to build is upon us.
With great power comes great responsibility.
You know the greatest danger facing us is ourselves, an irrational fear of the unknown.
Not because they are easy, but because they are hard.
This is the Superhuman Academy podcast.
All right, cool. Well, I'm really excited to dig into my brain, people's brains, explore the brain, think like a brain.
Let's do it.
with you today. So, just in case anybody listens to this, which I expect somebody will, somewhere, can you give a really brief overview of what you do and what's unique about it?
Yeah. So professionally, what I do is I analyze brain scans. I got my start in developmental pediatrics, and then 2009, after my residency, we started a large integrated mental health clinic. And Colin, I don't think we talked about this before, but I started a large integrated mental health clinic, and with a whole bunch of other providers from all different walks of life, psychiatrists, therapists, all different types. And it was amazing to me how little objective data was present in mental health. And so we started scanning brains and looking at it to help us with treatment and diagnosis and so forth. And it just evolved from there, and it became a kind of a common language or a common thread that most of us within this collaborative unit could kind of understand when we were talking to patients, And so, that's how we got started all the way back in 2009. And now we're 50,000 scans deep into this work, and it's been a great learning experience. We're learning every day still.
And what are the tools that you use to brain scan?
Yeah, thanks. Sometimes I forget. I'm so into the I'm in the cave. Once in a while I come out and I forget that not everyone's scanning brains. So what we use is a technology called EEG. It's a electrical measurement. It's been around for over 100 years. And we take this technology, and where it's different, where it's unique, is that we, instead of just looking at squiggly lines, which is kind of like the outline of the mountains. Okay, if I take a outline of the Front Range here in Colorado, you can see the mountains that are up close, and you can see an outline of them. What we want to do is actually fly over the mountains and see what the whole landscape looks like. So you have the valleys and the peaks and how far it reaches and where the mountains are. And so that's what we do with the EEG data. We actually quantify it, turn it into a whole bunch of numbers, and then now we can use really cool tools like AI and different types of machine learning tools to actually make patterns that we wouldn't be able to see with our naked eye. And that helps us understand people's brains better, what works, what doesn't work as far as treatment and so forth.
Mm-hmm. And what does that actually tell you? Like, what kind of data is that? I suspect that you're not seeing my thoughts in little thought bubbles.
So it's so funny what you say that, Colin, because I can't even tell you how many people, if you dig a little bit, there's this little worry in the back of their mind that maybe he might know what I'm thinking. It's so funny. And so, but anyways, no, we can't tell what you're thinking. That would be pretty cool. But it's more around how the brain's functioning, like which areas are active, which areas are underactive. Some really neat tools on how we respond to stress, things like that, and trends. And so we have these sort of energy levels in terms of is the front part of the brain more active, or the back part, or the temporal lobes with memory and so forth. And then we also have filters that we look at too, which is kind of like how we interpret our environment and how that might shape our interpretation of pretty much any given event. Like us sitting here talking, is that fun and exciting, or is it terrifying? And so we can look at the brain patterns and be able to predict that and take that to whatever level you want to do, supplements, meds, meditation. How do we want to guide these interventions to the person who's actually sitting in front of us?
Okay, so with that in mind, that kind of suggests that there are more or less healthy patterns.
Yeah.
Because you suggest okay, well, we might see something as underactive, which suggests that there's a sort of ideal baseline or something like that. So can you I guess what I'm asking is there sort of an ideal pattern that you'd be aiming for?
Yeah, so I hear you trying not to use the word normal. And so I do that. I try very hard not to use that word normal because, when we first started, it was show me, do they have ADD? Show me, is this person depressed? And so we would look for these like, kind of like deviations, okay? And
Uh-huh.
there's published data on all this stuff, okay? So like there's people that study, in these silos, they study depression, and then people that study ADD, and this has all been, this work has been out there, and we're just trying to kind of pull it all together. So so there are trends that tend to be associated with more of those types of symptoms. And so that's what we look for when we're trying to understand the person in front of us. Like, does my kid have ADHD, or do I, have a sleep disorder, or whatever we're kind of looking at. But what we found over the years, and the more and more I do this, especially in spaces like peak performance and in really niche groups like racing drivers or, first responders, people that are really, kind of in their zone, and probably the high level of what they do, Navy SEALs and things like this, okay? What we see is that the lines become very blurred, okay? And what becomes abnormal is to have a normal brain, but be in that environment, be in this peak performing environment, because that doesn't generally happen. People with normal brains do like kind of normal, boring stuff. They come home, they park their car in the garage, they close the door, they sit down, they read the paper. And it's just, it's kind of like that's okay. Like if that's your life, that's fine. But people that are doing really cool stuff, and the most interesting conversations I have are people with the most, kind of deviant looking brain patterns, at least according to the literature. And so what's what's happened with that is that this idea of normalcy has sort of gone out the window, because ultimately I think what happens is you have an abnormal, again, abnormal looking brain in an abnormal environment, and they either gel or they don't. And if they don't, you know it. You know what I mean?
Mhm.
Yeah.
Yeah, I've shared this both times we've talked already, but I wanna put it here too in the recording, which is this, quote, which I think is from Einstein, though
Oh yeah.
everything's attributed to smart people or whatever,
Yeah. Yeah.
um, that, everyone is a genius, but if you judge a fish by its ability to climb a tree, it'll spend its whole life thinking it's stupid, right? There's this idea of, like, every person is endowed with unique abilities, talents, skills, potentials,
Yeah.
um, but in an environment where those are not, um, what's the right word?
I think like honored maybe,
Yeah, valued was
yeah.
maybe the word that came to mind, valued or, allowed to be expressed fully,
Mhm.
then, yeah, you can spend your whole life thinking you're an idiot even when you got a ton
I
of
tell you,
potential.
Colin, it happens all the time. It happens so much. It happens in a lot of different areas, but where I see it a lot are with children and parents when the kid is an artist and the parents might be scientists, and they don't understand. They just
Mhm,
don't get it. Like, why does my kid not want to go to college and graduate school and go be a scientist like me? And why are they, goofing off in school, and they want to, go be an actress in Hollywood, and it's like, I don't get it. Like, I don't understand. What did we do wrong? But
mhm.
it's really, yeah, it's about that fit. And it's funny because that quote you told me the last time we talked, whatever, a couple months ago, it really stuck with me. And I was like, we used the quote about the Huskies. So I got a couple of
Mhm.
Huskies a few years ago, and we would travel back and forth to Arizona. We had this big RV. We were racing go-karts at the time, me and my boys, and we would drive back and forth to Arizona with the Huskies. And in Arizona, they were miserable, but when we went up to the mountains, they were happy as can be. And I'm thinking about brains, and I'm thinking about our evaluations and all the stuff we do. And I'm like, if you evaluated these dogs in Arizona, they would look depressed and they would look defiant and just kind of ornery. And but if you evaluated them in a park when they're playing in the snow, they're as happy as could be. They're great. That's what they're wired for. And so that's how we came up with the husky analogy that we use in the book, the husky
Mhm.
phenomenon. And then you tell me the one about the fish and Einstein. I was like, oh man, like
Yeah.
it's good to be in this league of Einstein level analogies.
There you go. Yeah, like, for me, I did well in grade school, not
Mhm.
so well in college, at least at the beginning, but in grade school, I didn't really have to try very hard. I would, um, I wouldn't know there was a test. I'd show up on test day and be
Yeah.
like, "Oh, there's a test today," and then I'd do just fine. But I hated school.
Yeah.
I was miserable. Like, I can't tell you how many hours I just spent staring out the window, zoning out, doodling, looking at the clock, just like, "When can I
Yeah.
when can I get out of this room? And yeah, and then like now the work that I do, I would describe it as somewhat academic. I mean, it's very applied, but I spend a lot of my time studying and writing and doing this types of things you might associate with like academics. But
Right.
and yet I hated school.
Mhm. Yeah, but
You know?
it's directed now, right? Like when I went to school, when I was in medical school, there was 2 things I wanted to study. It was pediatrics and neuroscience. That was it. Nothing else I cared about. I didn't
Yeah.
care. And so what I did is I don't think I told you this either. I used to record all the lectures, and I would go ride my bike and listen to the lectures
Mm,
from the day before.
sure.
So I would be out for 8 hours a day, just miles and miles, just grinding on my bike, listening to the lectures from the day before. Because if I was there in class, I'd be doing what everyone else is doing, just goofing off on,
Yeah.
MySpace at the time or whatever it was, goofing around and just scrolling online. I was like, "What a waste of time. I could be doing what."
Yeah.
Yeah. Yeah.
Well, that's what I've been, the more I've learned about the brain and how people work, uh, well, I guess the more sad I am about how like our systems are structured. And I don't
Mhm.
want to go on a long rant about school systems or anything like that, but it's just we have a population of unique individuals with unique potentials and unique
Yes.
environments in which they thrive
Right.
in different ways in which they approach it. And then we're putting them all into a pretty conforming, sterile sort of
Mhm.
box.
Yeah.
It's very strict and like you said, very like, I think you were using the word directive in a different way. Like,
Yeah.
everything is like, "Here's exactly what you're gonna do. Here's when you do it. Raise your hand to talk, like, go to the bathroom at these specific times.
Mhm.
Don't leave this room until the bell rings. Sit still. Like,
Yeah.
listen to somebody talk." And I think a lot of our society is sort of structured that way. Even, workplaces, I think, are structured pretty close to that way in a lot of
Right.
senses. It's like, "Alright, you show up at this time, you leave at this time, here's your desk, here's your little cubicle, like,
Right.
this is where you work, you sit at this computer." And it just strikes me, like, the more I learn about people and the brains and how, like, this is just not that's not how people work. That's not
No.
it's kinda strange to me that we've developed a society that's so anti-human.
Well, it's not how you get the best out of people, it's not
No.
optimizing their gifts and their geniuses, and you're fitting under that bell-shaped curve, and I have a lot of sympathy for these organizations. Like, they have to work with the tools they have, right? Like, the school
Mhm.
system doesn't have these brain patterns. It's reactionary, and that if a kid causes problems, then we create an ecosystem, after that. It's the same in the workplace. Frankly, it's the same in our prison system, right? I mean, a
Mhm.
lot of those
Yeah.
people are people who have these really amazing brains, but they're in an environment that doesn't support it. It's like same with the dogs. You back them into a corner, not to compare prisoners to dogs, but if you back a dog into a corner, it gets aggressive. Like, what do you expect? But like, let's put it in an environment where they thrive and not have it feel threatened. So it's yeah, it is it can be frustrating. I mean, again, it depends on our filters, right? So there's a half full and a half empty version of these filters we all have in our brains, right? And so if you look at that situation, we can see that and measure that and say, this is sad. This makes me sad that this happens, or there's a whole lot of opportunity. Where can I make an impact? And again,
Sure.
it's not this sort of fluffy thing I'm talking about. Like, from a brain pattern perspective, you can look at that and say, who's gonna look at that situation through which lens. But yeah, you're absolutely right. I mean, you with these patterns in suboptimal environments, we just don't really get to see all these people's gifts. And I think it really starts at about probably 9 or 10 years old when we get those early brain scans, and you can really change the course of a kid's life to then, where every day is about peak performance and every day is
Mhm.
about creating an environment that just knocks it out of the park for them?
Yeah.
Yeah.
I think that's where I'd like to explore with this conversation,
Sure.
'cause I think at the big picture level, like, "Oh, society," whatever, we could rant about how
Mhm.
it's, not
Yeah, yeah.
perfect, but it's never gonna be perfect. But what we can do, like, I'd like to explore what can individuals do to shape their life and design their environments so that it works for them and their kids. I think that's, for me, that's something that's really important, just being able to, um, help my kids to grow into their who they could be and get to express their potential. So You've already well, someone scanned my brain, so you've already
Yeah.
looked at that. I'd love to pull that up at some point, just so people can actually hear an example of the specific things that you're looking at and looking for. Um, but maybe it would be helpful to set more of a context. So you've described it in more general terms, but what can an individual person do to learn about their brain and how to, design their lifestyle for that?
Yeah. A lot of times what we do in the space of creating these environments, whether it be a Waldorf school or a Montessori school or, whatever, when you start going through the school system, it's trial and error, just like it is with medications. It's like, this worked for this kid. Is it going to work for my other kid? I don't know. So it ultimately comes down to not what works for individuals, but what this thing works for who, like for which person. And so we have to start to identify these patterns. And, I know we didn't talk about this before, but I think probably by the end of the year, we're gonna be in a place where we can access all the edges of the earth with the what we do with brain scans. Okay, right now, and obviously you went through that firsthand. There's a little bit of friction if we don't have a provider in your area, or we don't have someone who can do a good scan for us nearby. We have to jump through some hoops to find someone.
What's changing this year that would
Or technology and portability. It's
okay.
evolving so rapidly, and so, the equipment is it's come down in price, and then it's sort of gone back up as, we've gotten to more sophisticated technology, but the issue with that is that it makes it very hard to get this into people's hands. Like, I have a doctor in Libya right now who's trying to do surgeries, on kids. I can't get equipment over there, it's too expensive,
Mm,
it's difficult with traveling and, all of these sorts of things. So it's like, how do we get how do we make this accessible for everyone so everyone can understand? It's easy as an Aura ring on their hand. How can they understand
mm.
what's going on in their brain, in any
So do
given moment?
you think in the near future, like, the average person will be able to just scan their brain whenever they want?
It's challenging because it's kind of like the computer, verbiage, whatever that is, garbage in, garbage out. If we're recording garbage, which is easy to do with EEG, if you don't get a good scan,
Mhm.
then you're analyzing garbage, and I could put a scan on my refrigerator, an EEG on my refrigerator, and I'll make pretty pictures out of it. Doesn't mean it's useful. You know what I'm saying? Doesn't mean it's useful. So how do we get good, clean data, get it analyzed by someone who knows what they're doing, and then turned into, actionable stuff. So I think ultimately it's going to come down to having that information on each other, on our kids, as part of like a physical exam. It's like we just do this as like a sports physical. This is your brain pattern. These are your risk factors, so forth. And
Mhm.
how do we optimize that? So I know it's not the greatest answer in the world. We want to be able to help right now, and we can do that generally speaking if we understand these patterns. Um, but yeah, I think ultimately we have to have the data because otherwise we're just guessing, just like we're doing with, our psychiatric evaluations and our treatment right now. It's all subjective, and
Mhm.
we want to bring objective data to that conversation.
But you threw out that end of the year. It sound like like, maybe there's some breakthrough happening right now. I'm just
Yeah.
curious where that came
There
from.
is, there is. We're working with a company right now to try to develop a system that'll give us, research level data in a portable delivery system, so we can
Got it.
access. So again, we can, if we have a patient in Mexico or in Canada or wherever they are, we can ship them a unit. They can pop it on with
Got it.
the remote recording and be able to get us that data, and we can turn it into a report, very quickly.
Okay, very cool. Yeah, I'm excited for that. Like, when you said that, I was like, "I have an Oura ring on my finger right now. I'd love to be able to just
Yeah.
have
Well,
have
imagine if we start to
thing."
tie that together, Colin. Like, imagine if we start
Yeah.
to, we say, look at your brain when you only get, 7 hours of broken sleep. This is what your brain patterns look
Oh,
like.
I'd love to be
Instead of
able to see that.
readiness, this sort of, readiness has a number of markers that it uses to make that score in your Oura ring. But what if we could pair that with your EEG data? Like, hey, on the days you have coffee, you're more stressed, and maybe
Mhm.
maybe caffeine shouldn't be, part of your routine, and alcohol and all these things, and I think people like us that really like data, you see that and you're like, I get it. I get
Mhm.
it, like this is good for me. Or this meditation works really well for you, but this meditation over here, not so much. You need to be doing this one over here, and actually having that data to show. So it's really cool.
Yeah, man. I get excited by that sort of thing. I'd love to have, like, all the data, like, all on myself. I'll hook up whatever I need to hook up.
Let's do it, man. You can be our guinea pig for all this stuff. Yeah,
I
it's
love
fun.
that. Yeah, when I walked into that clinic that you sent me to the other day, they were like, what are you in here for?" And I was like, "I I don't know." Like, "Well, I don't know, hook me up with whatever you're hooking me up with." To like, "Do you know what you're getting scanned for?" I was like, "Not really, just
No, no,
I don't
science
care."
experiment,
Like,
science
just
experiment. I
hook it up. Let's see.
Yeah,
I wanna see whatever I can see."
yeah, they were as
They kept
confused as
giving
you.
me funny looks. I was like, I'm just the guinea pig. Let's do this. Give
Uh,
me the data."
yeah, yeah, and that's the thing too, we keep learning, like, as everyone does a scan, so, we have, like, 50,000 plus in there now. As you get more and more scans in there, and we look at how people respond to treatment, how they don't respond to treatment, what sort of diagnosis people have, and all these sorts of things. The system gets smarter and smarter, and it helps the
Mhm,
person after you. It helps them to prevent that rat race. It helps them to identify early biomarkers for, these types of things. And so it really is, it's a really cool process to be able to take that and learn from it and, again, try to create these ecosystems. But going back to what you were asking about the, kind of like what people can do. I mean, I think really it comes back to understanding our brains and which environments support them because, you know, everyone wants to know like what's wrong with my brain or what's wrong, how come I'm not responding to this treatment or, whatever it is when they come into a clinical setting, right? But in real life, all the patterns we've seen, okay, all the different patterns, okay, we measure 12 right now. In your report, there's 12 different ones we report on. I should rephrase that. We report on 12, but we actually measure thousands. So if you do that equation, okay, and I had to ask a middle schooler to do this for me, okay, but if you do that equation, you do 2 to the 12th, you get 496 different combinations. That means a person coming in with depression or anxiety as a label can have 4,096 different possible combinations of patterns, all of which respond to different treatments, different parenting strategies, different environmental approaches, all of that sort of stuff. And so understanding that I think is the foundation to, creating these optimal environments for ourselves, for our kids, for employees even. I mean, we use this data to help us, create ecosystems where employees can thrive, and it's like,
mhm.
if you have a brain that slows down when it's challenged, okay, this is one of my favorite patterns, slows down when it's challenged, that person probably shouldn't be like your customer service representative, They probably shouldn't be like a 911 dispatcher. This needs to be someone who can think on their toes, quick, 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 not get overwhelmed. But they would be a great project manager, okay? And so we see this time and time again, Colin, where people have brains that don't fit their jobs and they're miserable, man. They're miserable. And you can do
Yeah.
all the work you wanna do. In fact, I can think of 2 people right now we're working with. They do all the work, whether it's the meds, the therapy, psychedelics, all of this stuff. It's like you can't keep going back to that environment is not going to work. But again, without the data, how would you know? You just think, "Oh, there's something wrong with me," or "People are dumb. I hate working with people," like whatever it is, Yeah.
Yeah, it's like the fish quote again. It's like,
Yeah.
no matter how many drugs or how much therapy or how much anything you give to a fish, it's not gonna be great at climbing trees.
No, no, that's for sure.
It's just not gonna happen. You throw it in the water and it's happy, it's functional, and it can move. So, um, would you mind pulling up the scan you did on me or they did on me that you interpreted the other day, and we could use that as an example?
Yeah, it'll take me just a minute.
Yeah, that's fine.
I have, I know what it says in my head because it's fresh, but
Sure, yeah, I'd love to screen share it. Those who like to watch the video, they'd actually be able to see, what sort of report they would get if they did a scan like this and what sort of data is there and get some sense of that. I'd love to show that.
okay, we're
And
making history right here. Never been done before on a
what, really?
on a live podcast
Oh,
report. an EEG report. This is great. Yeah, give me one
Yeah,
second.
go for it. I'm
I'm gonna get through the
I'm an
security.
open brain.
So I do, maybe to give it a little context while we're doing this is that, um, kind of going back to the fish scenario, is that when we look at the data through the lens of pathology, the patterns create a narrative and a story for us that becomes a conversation piece. Okay. And so, hey, I'm struggling with, for example, sleep. I'm having trouble sleeping. I'm waking up. So we go into the data and we look for patterns that could be potentially related to what their concerns are. And most of the time they're there. And if they're not there, that's okay too. That tells us that that problem's probably coming from somewhere else. Um, give me one second here. Here it is. And so, when we're talking about it in the context of pathology, that's how the story goes. But when you're talking about it more in the context of, human performance and optimizing performance, the deviations tend to be things that we like to embrace, not necessarily
Mhm.
change. So, for example, we used to do this work with racing drivers. My kids, I think I mentioned, were um, go-kart racers, competitive karters, and we would race all over the country. Okay. And we would, I'm just pulling up your map, and we would try to optimize, of course, their cart, and I did to the best of my ability, all their engines and all their stuff. They had a whole team, but we got into the brain space, of course, because that was my, it's my area. And so what we would do would we wouldn't necessarily change things that were deviant in their scans, but we would try to enhance some of that to help them be better on the racetrack. And so that's carried over now. Interestingly, I don't even think I told you this, Colin, is that that's carried over now, and now we're doing a documentary. I think it's gonna be on either Netflix or Hulu, I don't know which.
Oh, wow.
Professional racing driver studying his brain and how he went from world champion in his domain to drug addict, issues with legal, living on the streets. I mean, all of this stuff is very, very, very cool story, and understanding how his brain, got him to a place where he was, world champion, to the same place where he's homeless and on the streets. And so it's
Mhm.
really, really fascinating to see that in real life and go over those brain patterns.
So you're making this documentary?
No, there's a whole team. I was just,
Oh, okay.
a part of it, They
Got it. Okay,
probably
okay. So
probably clip a few quotes out of me saying
yeah,
this.
you were like a
Right.
little expert,
Yeah, yeah, yeah.
brought
I
in.
just saw the trailer actually yesterday. It's really, it's so
No
cool.
way,
I'm
what's it
so
called?
excited. No, I can't. I don't think I can
Oh,
say it
okay.
yet. I don't think I can say it, but I'll let you know, and I'll see if I
Yeah,
can
let me know. I'm
share it.
really
I'll
curious.
see if I can share it. I don't know if I can. But super
Maybe
cool.
maybe in the future, if you send me a link, we could add it to the show notes later once it's out
Yeah,
and
should
people
be
can
by
find it.
that. I heard by the end of the year we should know something on
Okay,
who's
cool.
picking that
Well,
up.
this will probably not this recording we're doing right now probably won't be published for, like, 6 months or something,
Okay,
so by the time
perfect.
it's recorded, maybe it'll be,
Oh,
at least
brilliant.
close
Yeah.
to being released.
Yeah, so I've got this here. Let me share, preview. So I have, about 600 tabs open here. So let's see. Well, I have a couple monitors that I work off of, so let me
Yeah, you're
see.
good.
It'll share the right one with us. Yeah, there we go.
There we go. Look at that.
Okay.
Alright,
So
so if anyone, if you're listening to this podcast and you wanna see what we're looking at, you can tune in on, should be on YouTube. You'll be able to actually see this is my scan, you can look right into my brain here and check it out.
yeah. So yeah, we have the dozen or so biomarkers that we look at. Now on the backside, Colin, we have these enormous Excel tables. That's what we're doing kind of on our research end is analyzing these huge data tables. Okay,
Mhm,
we look at ratios and how the brain talks to itself in different regions and all these sorts of things. But these are the markers that have been the most published in the literature, the ones that tend to be the most stable, the ones that tend to be the most clinically relevant. And so we look at those markers to then give us some insight into what's going on with the person in front of us. So
mhm.
so yeah, do should we dive into a
Yeah,
couple
I
of these
mean,
or
yeah, just d describe it as verbally as possible so those listening can get a sense of
oh
what
yeah,
we're
yeah, yeah.
looking
Of
at,
course, yeah,
and
because they're not looking. So yeah, so we have here the report goes into about 30 pages. I've got on the page here that is sort of like the markers that came from all the images. So as we
Mhm.
get further into the report, you can see where all the brainwaves are distributed, how much is there, and importantly too, how much is there compared to the other brainwaves. So like how strong is your gas pedal compared to your brake pedal? Okay,
Mhm.
so if those are balanced, that could be a good car to drive. Okay, but if one is sort of stronger than the other, we may run into into trouble. And so we look at all of that data in the rest of the report. It goes into strengths and challenges and so forth. But these particular biomarkers are the ones we're interested here for our conversation. So we have a number
Yeah,
of
great.
them. So you
Yeah,
had
share
talked.
whatever you want. You don't no need to censor yourself at all. You can say whatever you want.
Colin, I actually wish it was more weird because we could really get into the weeds with you.
Yeah,
But yeah, I think there's some interesting stuff here, and one of the things that stands out for me again, especially in this kind of human optimization or optimizing our brains and our environment, is this theta beta ratio. Okay, theta beta ratio is a marker that we've been measuring for a long, long time. Okay, it goes back 70s maybe I think is when
Mhm.
Lubarb and some of these other guys were measuring theta beta ratios. Okay, and um, this marker tends to be associated with symptoms that we often see in people with ADHD symptoms. And so when you are describing your youth in school, I'm daydreaming, I'm looking out the window, I just want to be out of here, I'm doodling. That's what kids who have high theta beta ratios do. Okay. They may be fidgety, they may be distractible and so forth, but they're daydreamers, they're big picture thinkers. And I think the work that you're doing, like the learning is scratching that itch for you, and you're diving into all this heady data, but it's in a very focused area of what you're interested in. And so you have this
Mhm.
high theta beta ratio, and again, unchanneled looks a lot like ADHD, impulsivity. We see a lot of gamblers. I actually have an odd number of professional poker players that we've done scans on. It's very interesting, fascinating world that I'm not very familiar with, but other than from doing their brain scans. But we've done a lot of professional poker players, and you'll see these patterns here that really crave that reward driven behavior, right? And people will lean into that type of behavior because it makes them feel good. Okay.
Mhm.
But if you don't have those patterns, it can be really hard to understand why someone would do that. So again,
Yeah.
the theta beta
And
ratio.
so just so those who can't see it,
Yeah.
so the range there looks like 1.5 to 3. I don't
Mhm.
is the ratio that's like that normal, quote unquote normal.
Yeah.
I know you don't like that word, but
Yeah.
it says it on this report a couple of times, normal range.
Yeah.
Um, and then the one listed for me is like a 15.92, which is obviously higher than that range. And it sounds, based on what you shared with me the other day, sounds like it can range a lot more wildly than that too.
Yeah, it is on the upper end. I mean, we do, working with a lot of psychiatric clinics, we do these for dozens and dozens of clinics, but you see a lot of, variability within there. But inevitably, there's going to be people coming in that are seeking treatment with symptoms related to deviations in these patterns. So again, in a clinical setting, we may want to push that number down closer to a 3, whereas people are that don't typically present with symptoms. Okay,
Mhm.
but in your sense, in an ecosystem that you can create, I would leverage that to its fullest extent. Like, what else can I do besides, jujitsu? I think you told me Brazilian
Yep.
jujitsu. Yeah, like how can I scratch that itch even more? Or here's a big one, Colin. This is huge. Is that what happens if Brazilian Jiu Jitsu goes away? Like, what do we
Oh,
do
I can
then?
tell you that.
Yeah.
I can
Yeah.
tell you that.
Yeah.
Yeah, whenever like, if I get sick or something like that, because you really can't train unless you're totally,
Mhm.
not contagious with anything.
Yeah.
Um, yeah, and it's kinda like an anchor for me. If I lose that, I definitely I get out of whack. Like,
Yeah.
I'm uncomfortable, I'm fidgety, I I've got, like, cabin fever instantly, I feel disgusting, I
Yeah.
simultaneously don't wanna do anything, and I wanna, like, just go, I don't know, jump out of my skin.
Yeah. Yeah.
Like,
It's
all that
fascinating, man.
stuff.
It's so fascinating. And as these numbers become more, away from that range of people that don't have symptoms, again, about 5 times more than people who don't have symptoms typically lie. Um, that's gonna be more pervasive in your life. And I think this becomes so important when people go through big transitions in their life. like my dad who's going through retirement right now, he was on his feet all day long, working and wrenching and, just nonstop until he sort of fell over at the end of the day, metaphorically, of course, but he would just grind and grind. Now he's in retirement and is like, what do I do? What do I do? And so that happens to so many men as they go through these transitions, whether it's, selling a company, losing a job, going through a divorce. And we think these things are trivial or just kind of like nice to do, but a lot of times we create these environments and ecosystems to scratch these itches, and when those things go away, it can be really challenging. For me
Mhm.
personally, a big one was my cycling. I mean, I used to ride hundreds of miles a week, okay? And then when I had kids, it's like, well, all of a sudden, an 8-hour ride is like, that means leaving your wife home with the baby for that much time. Like, even though she'd do it, I mean, it just doesn't seem, fair. And so I would have to go from, you know, doing 100 miles in the mountains here to doing a 20-minute Peloton spin class. I mean, I was like pulling my hair out. I was like, that's miserable, you know? And so how do you get that need met through other ways? And so yeah, and again, the more deviant these patterns are, likely the more deviant is gonna be to get those need to get the needs met. So like I was thinking about a racing driver, he went from, you know, racing around the track at 200 miles an hour, and when he couldn't do that anymore, he's doing crack, and it's like,
Yeah,
you
what would
know,
you expect so for the theta beta ratio, what number might you expect to see for, like, a race car driver?
it's up there. It's like this. It's like this. There's actually a,
Okay.
a, a combination of about 3 or 4 patterns that we see, and this hasn't been published. So this is like the non-scientific. This is the world according to me. There's about 3 markers that we tend to see in like world class racing drivers, and it's funny too, Colin, because I always loved motorsports. I was into cars. I grew up in Detroit. I really love cars, and I had this opportunity to go to racing school. And this was kind of somewhere in this amalgamation of me learning about racing drivers, studying racing drivers, and, sort of wanting to be a racing driver. So again, I'm a clinician then, I'm a physician, I'm working with patients. I get this opportunity to go to racing school, and it was amazing. I mean, it was a very cool experience. But when I got done, I was like, "Nah, I'm good. I don't need to do that anymore. Like, I'm done." And my buddy and I were gonna go in and split a race car. We were gonna buy a race car.
Wow.
It was gonna be our hobby. He did it. He did it. And I was like, "No, I don't think this is for me." And as I learned more and more about, racing brains, and we started to study this more in the field, like real time, I was like, "Yeah, of course not. I don't have a racing brain at all. Like, this is." I was trying to be a fish, in the tree. And so it just wasn't my patterns. But
Do you mind sharing what that TBR is for you?
oh, it's down. I don't know off the top of my head. I mean, I've done my scans like a billion times, but it
Yeah.
falls down under 3. I mean, it's just in that sort
Really?
of normal
Okay.
range. But it's interesting too, Colin, because I don't know if you could see behind me, but I have a bunch of guitars on the wall out in our living space, and I love guitars. I think they're beautiful. I can't play them at all. I mean, I suck at it. I suck. I used to teach lessons and stuff, but it was more like mechanical. It wasn't like this creative, like, artist,
Mm,
And we
yeah.
have we have a clinic in Hollywood that we work with, and all these, like, movie stars and creatives and directors and writers, and it's all these super creative brains, and it's like, yeah, of course you have these creative brains. That's why you do what you do,
Yeah.
and if you don't, it doesn't work. So for me, I mean, I love that stuff, but it's just, I'm not painting canvases right now. In fact, I'm painting by number because I suck at painting. But it's relaxing, you know what I mean? And this is what's so funny because you were talking, Colin, about, going out of your skin when you can't do martial arts, and it makes me so impressed where as a society, we can have a family all go on vacation together and, like, agree on anything, because we're all interpreting the world through these different filters. And so I sit down on the beach and I'm reading, like, how to finish your basement and how to build an outdoor kitchen. These are all true stories, by the way, and my owner's manual to my truck. These are the things I take on vacation with me to read, okay? And, and my kids are like, "Let's go on jet skis. Let's go, swimming with sharks. Let's." I'm like, "No way, man. I'm just gonna sit here in my hammock, come back, in 6 hours and flip me over so I don't get burned." And so but it just makes me amazed that we can even agree as a society because we're all filtering what happens in our world through these different brain patterns, and it creates a different reality for all of us, you know? And that's where
Mhm.
we get into these alpha asymmetries, I think could be really pertinent for your listeners, particularly people in peak performance space, high level people, you know, CEO people, C-suite people, like all that stuff. People who are really excelling in their life and in their area tend to have a pattern that's very, very common. It's called posterior alpha asymmetry. It's a relatively newer marker. And what it means, there's no quiz or anything, but I'll just tell you kind of what it means is that you have more alpha on the right posterior side of your brain than the left, okay? And there's a fancy equation that helps us calculate that, okay? And when we do, we see a highly stable marker in this back part of the brain, okay? And when it's there, we tend to see a lot more what's called negative self-referencing, okay? And these are people who tend to be harder on themselves, okay? And that can drive a lot of really high level performance. I have two friends, well, I have a couple more than that, but I have two friends that are professional bodybuilders, okay? And they do this, that kind of work where they're just in the gym, just beating themselves up because
Mhm.
of these patterns. I'm not good enough. I could do more. I got second place last year. I'm going to get first place this year. And it can drive that if you channel it. If you don't, it looks like a lot of shame and guilt every morning when you get up. You know,
Mhm.
imagine they're just sitting there drinking a six pack, scrolling on Netflix. They wake up the next morning like, man, I'm such a bum. I'm such a loser. Like, why did I skip my workout, whatever. And so, again, in the right environment, that posterior alpha asymmetry is a wonderful asset. And in fact, our high level athletes, the ones we scan that are, you know, professional, fill in the blank golfers, whatever, it's pretty rare for them not to have that pattern. And I think
Mm.
this really clinically opens up just a wonderful avenue to start to talk about, tell me about your self-talk. Tell me about what happens when the game doesn't go your way. Tell me about your gratitude journaling practices, you know? It's like
Mhm.
that for them, like, that's their gift, that's their superpower, but you have to be able to channel it, you know, and if you don't,
Mhm.
it's gonna look like a lot of shame and guilt, you know?
So I'm seeing this asymmetry on my scan on the I think it's the P4 over P3 one on the right.
Correct.
Is that what you're
Correct.
yeah.
Yeah.
Um, and I thought it was really interesting when you were sharing that when we went over these the first time, because I would consider myself to be, like, one of the least self-critical people,
Mhm.
like, I can imagine. Like, I just don't have I honestly can't really remember a time, like, I think for whatever reason since I've been a kid, like, that inner critic that people talk about, I just really don't have one. Um, but where I do resonate with what you're saying is, like, I also feel gross if I just sit and, like, watch TV. Like,
Yeah.
I get fidgety. I'm like, it's not like a, "Oh, you're bad, you shouldn't be doing this." It's more like a, "This is a waste of my time." Like,
Yeah.
I wanna be making use of my
Yeah.
time, and I wanna
Productivity guilt, right?
yeah, and I wouldn't even
Yeah.
call it guilt per se. It's more like a physical, like, sick feeling. Just like,
Yeah. Interesting.
"Ugh, I don't like this," and
Yeah.
I wanna be learning, I wanna be growing, I wanna be doing something challenging, I wanna be
Right.
exploring something new, um, and I also have this sense that I have a lot of potential, like, I've
Yeah.
always felt that way, like, I've got a lot of potential, and I want to explore that, like, what
So
is that? Where can I go? And I'm not doing it if I'm sitting here, so
yeah, Colin, you touch on something that's so, I think, important is that when those patterns needs are met, people people thrive. So imagine a scenario where you grew up in a house where, you know, people were cutting you down, you know, you're so messy, you're screwing up, you're whatever. You know, that message gets ingrained through these filters that I'm less than, I'm not good enough, I can't go on and do anything, okay? And so you may channel that to go then and go be the best. I mean, how many of those stories have we heard from Michael Jordan to, you know, across the board of people that were told they could never
Mhm.
amount to anything and they use that as their leverage.
I guess I do have some of that story,
Mm.
and it was yeah, it was less of me internalizing negativity about myself, it was more about me rejecting it from others,
Mm.
um, like, there's a very distinct memory of one time I went to a job fair in college, you know, for engineering, so there's just all these companies and everyone's lined up around the block to interview, and my grades were trash in my
Mm.
first couple years in college, like, my GPA was, I don't know, 2 point something low, which in engineering is like you don't get anywhere with
Yeah,
that.
no.
No, because like you're competing with a bunch of people with, like I'd stand in line. I still remember, standing in line at these job fairs, and basically all of the other engineers are just standing there like bragging on themselves, like in line,
Yeah,
like
yeah, yeah.
just one upping each other
Well, a
constantly.
lot of that comes from that pattern too,
Yeah,
right?
sure.
We see that a lot where they're just like, "Oh, yeah, my kid did this. I did this. I have
Yeah,
this
everyone's like,
car."
my dad invented space, like whatever. They
Yeah.
just and but I remember distinctly this one time I finally get to the front of this line, and a lot of the companies would advertise like, "We will not look at you if you have a GPA below 3.5," or something like that.
Yeah,
They'll put it right on their sign, right on their desk.
yeah.
But that wasn't gonna stop me from getting in line. I was like, "Well, I'm not gonna get a job not doing anything, so I'm gonna
Might
show
as
up
well be here.
anyway."
Yeah.
So I remember standing in this one line. I still remember the company it was for, but I won't say it. And I stood in this line for like an hour just to talk to a recruiter for like 30 seconds, and
Uh-huh.
show my resume. And I get up to the front of this line, and I didn't put my GPA on my resume, of course.
Yeah, yeah.
And so we talk, we're, smooth, hitting it off, feels pretty good, whatever, and he seems pretty positive, and then he asks, "Oh, like, oh, I don't see your GPA on here. What is it, if you don't mind me asking?" And I told him, it's like 2.3 or something like that, and everything changed. I mean,
Oh,
this guy went from, buddy buddy to, like, storm cloud instantly,
uh,
and he said to me, I don't remember his exact words, but it was very close to, um like, by standing in this line, you have taken away an opportunity from someone who deserves it.
oh, jeez.
And it was very much like a how dare you even get in line for this?
Yeah.
I'm like, are there other people who are smarter, who have worked harder, and because you're
Oh,
standing here, you took an opportunity away from one of them?
that's
And
a shame, man.
I remember walking away from that, and it messed with me,
Mhm.
not because I was like, "Oh, he's right," but because I was like, "That is like, oh, I'm gonna prove that guy so wrong."
100%.
Like
100%.
like, screw that.
Yeah, yeah. Colin,
So,
this
yeah,
is
I feel that.
so interesting that you tell that story because you and this really is a testament to understanding brain patterns and getting the right butts in the right seat. You have brain patterns of highly creative people, okay? And the creativity can be problem solving, okay? It's not just art and music, and it can be problem solving. But you also have what's called a mu rhythm, which is often associated with engineer type brains. They tend to be more analytical people. We studied this. This is one of the first papers I wrote in 2009. And we see this pattern a lot in autistic populations, but we see it not necessarily as a diagnosis for autism, but we see characteristics where people can have sort of neurodivergent ways of thinking and problem solving. And so if I'm creating an engineering group, okay, and there's a second part to this story. If I'm creating an engineering group, I want a Colin brain on our team like this that's going to be have precision level, um, goals. Like good enough isn't good enough typically for people that have these patterns. Okay, and then the creativity combined with the mu rhythm, which tends to have that kind of, like I said, analytical element. I mean, obviously I can say this in the position I'm in. I'm not the recruiter, but I would hire you in a second for that type of position. It's fantastic. It's fantastic. So I'll tell you a quick other story. A real world application is that I have a friend who barely graduated high school and has brain patterns very much similar to yours and has multiple patents in different areas of engineering. Was lucky enough to get a job kind of like what you described, but they let him in even though he didn't have, the accolades or
Mhm.
the degrees or none of that stuff. And then went on to lead whole teams of engineers that all had high level degrees. And here's this guy who barely got through high school, but he had the right brain patterns and he was in the right seat. And so he had to prove it through, you know, his patents and his designs and all that sort of stuff. And unfortunately, that's how the system is set up. But imagine, just imagine, man. I mean, how different your life is if or would be if you had, if we hadn't looked at the grades and we just would have looked at that. So I
Well,
mean, I think
yeah,
we're all on on the right track, of what we should be on to learn at that moment. But yeah, I mean, just from a brain patterns perspective, I mean, geez, it could have totally changed your course.
yeah, well, the funny arc to that story, and I'm not even in engineering anymore, and I don't
Yeah.
really wanna be, even though
Yeah,
I
yeah.
still really appreciate and love systems thinking and things like that, but what was funny is somebody did give me a chance, right? There was a local company that did hire me, not on the strength of my GPA, but I had some recommendations, and yeah, they were open to it, and I ended up, with an internship there, and then I ended up there was like a bunch of us interns. I ended up being like the one who was kind of selected out of this group, like presenting to the owner what I had come up with, and they ended up implementing what I had done, like totally redesigned their system for their core product, like their main thing that their business was
Wow.
based on my intern project. They hired me onto their senior engineering team directly out of college. And then I end up going back to Purdue where the job fairs were as a recruiter, like on the engineering team. So now
Yeah.
we've reversed the position. I'm now standing there like seeing these resumes. And one of my former TAs comes up to interview for the job that I currently hold.
Yeah.
We were getting someone else on our team, and I had to turn him down because he didn't have 15 years of specialized industry experience
Oh, jeez.
to have the role that I had, even though I'd just gotten out of college. So
Yeah.
it was such a funny arc of,
Yeah.
going from getting rejected to being in the opposite. I didn't tell him, like, I didn't flip it on him and be like, "You don't deserve this role," or anything like that. I was just
Yeah.
like, "this is sorry. This is
Yeah. These are the
what's
requirements.
required." But it was a really funny arc, and I appreciate that it all happened. I think that guy was kinda being a dick, but still,
Yeah.
it definitely did give some flavor to my story arc.
Yeah. But yeah, I mean, imagine that. I mean, how much of this stuff that we do, whether it's interviews or even picking our jobs, that's been an interesting course to talk about with the scans. But, what vocational direction should we go with a brain pattern like this? Should we go and do this thing? I had this family one time because we're close to Wyoming here in northern Colorado, these ranchers, and they had this daughter who wanted to go off to Hollywood to be an actress, and they couldn't understand why she didn't want to just stay on the farm and breed cattle and milk cattle and do all that stuff, and I was like, yeah, she's got an actress brain, send her. And I think they just kind of were like stunned. I was like, yeah, if you keep her on that farm, she's going to run off with those cowboys on their dirt bikes and on their horses, and you don't want to know what they're going to be doing. So yeah, send her to Hollywood to be an actress.
Oh,
So
that's
yeah,
interesting.
it's really interesting though, because we do a lot of this stuff, whether it's like parenting or whether it's couples work or whatever it is, and we do this just with like intuition and gut feeling, and which is great. It's great. In fact, we're doing a study right now, Colin, with kids with special giftedness like telepathy and like other things, which
Mhm,
was a whole new world to me when they approached me with this
mhm.
project. And I started looking into this and reading more about it and so forth. And it is super fascinating. But imagine if we could just look at that and start to leverage that information and support those kids instead of them feeling, weird or dumb or not fitting in. It's like these guys become superheroes.
Yeah, exactly.
Yeah,
In our last few minutes, I wanted to ask one more selfish question about
for
my
sure.
scan that I didn't ask last time we spoke, which was there was a huge difference between my eyes open and my eyes closed in
Yeah,
terms of the, TBR, the theta beta ratio.
yeah.
Like, I think it was eyes open, it was quite high, and then eyes closed, it was very low. It was, like, below the normal range, and I was just curious about that. Like, does that tell you anything? Is there any
It does in the
implication?
other direction typically. Okay, so some of this is nuanced. Okay, and we have to look at it through sort of more of a gross lens. Like I remember you telling me about trying to stay awake and being fatigued and so forth. So that can play a role, but it's still going to create a column that we recognize. Like if you do another scan tomorrow, next week, next month, we're still going to know it's you. That theta beta may be, a 10, 11. It's still going to be high. Okay. And with your eyes open, it's still going to be, kind of in that normal range or, expected range and lower. What we don't want to happen, and this is one of my favorite patterns to talk about, I'm glad you brought it up, is where your brain actually slows down when it's challenged. So sort of the inverse of what you have. And for people that
Okay,
have yeah, yeah,
so my
go
my TBR was high
ahead.
with eyes closed or open?
Closed, that's the standardized way
Closed.
we measure, yeah, yeah.
Got it. Okay, and then open, it was on the low. So you're talking about if that's flipped
If it's
the other
flipped,
way?
yes,
Okay.
this is fascinating. This is what we talked about in the book actually was,
Mhm.
um was a girl who had come in who had had panic attacks. She was in a residential addiction center, and she had had panic attacks, and they'd been treating her as if her brain was sort of going too fast, rightfully so. I mean, that's what we do. But when we looked at her brain, it actually looked like it was slowing under load, and we changed her course of treatment drastically. And she, within days, was a whole new person. And this is a girl who went to 3 different residential treatment centers. Okay, finally in an addiction center, and she's just got panic attacks. It's not for substance use. And
Hmm.
so, that's when we first started to learn about that pattern. So circling back around to your listeners is that what this looks like these are people who tend to shut down when the demand goes up. So there's people that perform well under pressure, okay?
Mhm.
I think of like the cleanup bowler. So like in Detroit, everyone's a bowler, right? And so the cleanup bowler, that was me. I would be the last one, and we would perform under pressure. In hockey, I was the goalie. I did that all the way through college. I was a goalie, still do.
Mhm.
Um, and so that position requires a lot of performance under pressure. Okay, but if you have a pattern that slows down under pressure, like a computer with too many windows open, it freezes up. And so what ends up happening with people is that they freeze, they shut down, they may get defensive, they may have confrontational. But what we see a lot, Colin, is maladaptive, self-coping, self-medicating strategies, pot,
Mhm.
alcohol, escapism, not in a good way, So if it's channeled in a good way, this may be an ultra marathon runner. Okay, because I just run. Running is my therapy. How many people have you
Mm.
heard say that? That can be their superpower. Okay, but if they channel it sort of maladaptively, it looks like failed relationships. It looks like anger issues. It looks like all of that stuff, and it becomes really challenging. It looks like, oh, this guy's just a jerk. It's like, no, he's being pushed, or she is being pushed beyond their capacity. So it's trying to get them to do something that their brain isn't wired to do. And so when you hear, someone that says, you just need to do this exercise or this meditation or this breath work, it's like, okay, that works for your brain pattern, but what does it do for mine?
Yeah.
That's the question we really, really want to answer. Because I'll tell you, like the Wim Hof breathing for me makes me very anxious, makes me feel not good at all. But for the right brain
Mm.
pattern, that it's gold. It's gold.
Yeah, for me, yeah, I did Wim Hof quite a bit for a
Mhm.
while, and it definitely energized me. I felt more alive, more awake, but I noticed when I did it daily for, like,
Mhm.
weeks, I felt, like, spread really thin, like,
Yeah.
brittle, and just
Mhm.
kinda
Yeah, there's a guy actually who was studying this. So we were working in the addiction center, I'll tell you real quick, and they were doing meditation on everyone. And I raised my hand and I was like, well, I'm looking at the brain scans here. I don't think everyone should be doing this meditation. And it was like someone took the air out of the room, like, what are you saying? We shouldn't be able to do meditations. Meditation's
Yeah.
good for everyone. I was like, yeah, it is, but we might want to think about who does what? And so I dug into some literature and I found this book that was printed by a guy named Tarrant, and he was doing what's called neuromeditation. He was taking brain scans and pairing them to
Wow.
meditations. And I was like, hey, finally, here it is, here it is. So we've since had some conversations, me and him now, but I was like, this is what I'm talking about. We need to target our meditations. A brain like yours might be better with like Tai Chi and like mantra based meditations, but someone whose brain is more over aroused, like say mine, is going to be like, quiet mind and transcendental
Mm,
meditation, things that slow you down, But if we try to apply that to everyone, doesn't work, man. Doesn't work. And then it looks
yeah.
like, oh, what's wrong with me? How come I can't do this thing?
Ah, man, I'm so glad you're collecting data on this because it's like, it that makes so much sense, but if you just have a set of tools, like, "Well, these are my 5 tools,
Yeah.
so this is what we're gonna use," and it's like,
Right.
well, that if that doesn't
Yeah.
work for that person, then you're just kinda like, "Just keep trying."
Yeah, well, it looks like the patient maybe is not compliant or,
Sure.
something's wrong with them or, whatever, but it changes that whole narrative instead of what's wrong with me. I'm a brain that doesn't belong in here. I mean, a husky isn't kicking itself for being, you know, struggling in the desert when it's wearing 2 coats, you know what I'm saying? And so why do we do this with our partners, with our employees, with our kids, all that stuff?
Yeah, exactly. Well, I know we're coming up on time. I'd love for you to share, like, how people can learn more about you and also the name of your book so they can be on the lookout for that.
Yeah, so the book just came out. Again, depending on when this comes out, it's doing great. #1 in psychiatry, I saw now. It's like so cool. I mean, I didn't even think anyone would read it. I was like, I just, I just wrote it to get it out of my brain. But yeah, it's doing great. Think Like a Brain. So it's at thinklikeabrain.com. Our work as a business is Axon EEG Solutions. That's where you can find most of our work, publications, get a hold of us. And I still have my foot in the door at Wholeness Center, which is the clinic we started back in 2009. So that's Wholeness, WHOLENESS, wholeness.com. And so there I'm still, probably through the end of the year, I'll still be doing a little bit of clinical work there, but then I'm going to stay in my cave and just do this.
Awesome. Well, thanks for cutting my skull open, showing my brain to the world, Dr. Steve.
Clarify, it did not hurt. We did not cut your
It didn't
skull.
hurt. It did not hurt. I didn't feel anything. It was great. All right. Thanks, Dr. Steve.
Yeah, you bet, man. Good talking to you.
The Superhuman Academy podcast is hosted by Collin Jewett and designed and edited by Army Cinco, with original music by Joshua Schunig and voiceovers by Corey Page Schunig. That's me. You can find past episodes and resources, as well as access to the ever-growing Superhuman Academy community at superhumanacademy.com. If you like the show, don't forget to subscribe and leave us a review on your podcast platform of choice.